So now we're going to talk about the red rashes of childhood. Medical students often find rashes challenging because they can look very similar and be confusing on exams. We're going to try and distinguish between the number of rashes that can be seen in the pediatric population. There are 7 important rashes that are seen in childhood, and they're caused by Coxsackie virus, HHV6, measles, parvovirus, rubella, varicella, and strep pyogenes. Notice they're all caused by viruses except for the rash caused by strep pyogenes. First, starting with Coxsackie type A, this virus can cause hand, foot, and mouth disease. This is a very common vesicular rash that's seen periorally or around the mouth, and it is also seen on the palms and soles of the feet. These spots are tender, and the disease is very common in children in the summer months. HHV6 is a herpes virus that can cause roseola. Roseola is a macular rash, as seen here, that can spread over the entire body. This rash usually appears several days after a very high fever, and it usually infects infants. In fact, the fever can get so high that it can lead to febrile seizures. The measles virus is a paramyxovirus that causes a rash that begins on the head and moves down. This is what the rash looks like on exam. It's important to note that the rash is preceded by the 4 C's of measles, which include cough, coryza, conjunctivitis, and Koplik spots, or blue spots seen in the oral cavity. Parvovirus B19 causes what is known as erythema infectiosum. This is also called slapped cheek disease. The reason it's called slapped cheek disease is due to the red rash that forms on the cheeks of patients infected with parvovirus. Do you remember what it does to neonates if a pregnant mother is infected? Remember that parvovirus can be transmitted transplacentally from a pregnant mother to a neonate and cause hydrops fetalis and even death. Do you remember how parvovirus presents in adults? It can present as a rheumatoid arthritis-like symptom. The young boy pictured here displays the characteristic maculopapular rash indicative of rubella. Rubella is a toga virus, also known as German measles. It is a more mild form of measles, typically lasting 3 days, and causes a rash that also begins on the head and moves down. Do you remember the classic location of lymphadenopathy in a patient with rubella? It's post-auricular lymphadenopathy. Very good. Strep pyogenes is the one bacteria responsible for rashes in children by causing scarlet fever, which is an erythematous, sandpaper-like rash throughout the body. It is typically accompanied by a high fever and a sore throat or pharyngitis. It can present with a strawberry tongue, which looks like this image, commonly seen in scarlet fever. Now, when you see a child with high fever, a rash, oral lesions, and lymphadenopathy, what important vasculitic disease do you need to rule out? You need to rule out Kawasaki disease. Now, what is an important clinical feature of Kawasaki disease that is not seen in scarlet fever? You can typically see a bilateral conjunctivitis in Kawasaki disease. Do you remember how we would treat a patient with Kawasaki disease? We would treat him with aspirin. And do you remember why aspirin is dangerous in a child? Typically, we want to avoid aspirin in a child because of the risk of Reye syndrome, but in the case of Kawasaki disease, it is the drug of choice. Lastly, varicella zoster virus, or VZV, causes the chickenpox. This rash usually begins on the trunk and spreads to the face and extremities. Do you remember how that differs from measles and rubella? Remember, the rash of measles and rubella starts on the face and moves down, while the rash of chickenpox begins on the trunk and spreads to the face and to the extremities. This image here shows the vesicular lesions of the chickenpox. It is important to note that patients with rubella and measles do not have vesicles. So to review, there are 7 rashes of childhood: the Coxsackie virus, which causes hand, foot, and mouth disease; HHV6 causes roseola; measles virus causes a measles rash that starts on the head and spreads downward; parvovirus causes erythema infectiosum or slap-cheeked fever; rubella virus causes German measles; strep pyogenes causes scarlet fever; and the varicella-zoster virus causes chickenpox. Very good. So now let's spend some time talking about the sexually transmitted infections. These are an important set of infections that are high yield for board exams. Many of them cause similar lesions in the genital region, and it will be important for you to be able to differentiate between the clinical features. We'll start with possibly the most infamous sexually transmitted disease, AIDS, or acquired immune deficiency syndrome. AIDS is caused by infection with human immunodeficiency virus. The virus infects CD4 T cells, leading to impaired cell-mediated immunity. Do you remember the HIV protein that is key for viral entry into cells? That is glycoprotein 41. Very good. The reduced cell-mediated immunity makes these patients much more susceptible to opportunistic infections. Next is the disease chancroid, which we can see here. Chancroid is caused by Haemophilus ducreyi. This bacteria causes painful genital ulcers. In addition to being painful, the infection leads to inguinal lymphadenopathy, as we can see here. If the stem of the question informs you that the ulcer on the penis is painful, it is an important manifestation because it distinguishes it from primary syphilis. Remember, primary syphilis causes a painless ulcer on the penis. A way we can remember this is that chancroid is so painful that the patients do cry E. Help you remember that's caused by Haemophilus ducreyi. Chlamydia is the most common sexually transmitted infection. Chlamydia is an umbrella term to describe the inflammation of the urethra, cervix, conjunctiva by the bacteria Chlamydia trachomatis. These infections are caused by serotypes D through K. Cervicitis is the most commonly asked form of chlamydia infection and is characterized by a mucopurulent discharge. The discharge is more watery and less thick than a gonorrhea cervicitis. It's important to know that chlamydia infections can also lead to a reactive arthritis known as Reiter's syndrome. It's also important to know that it is an important cause of pelvic inflammatory disease. But thinking about Reiter's syndrome for a moment, do you remember what reactive arthritis or Reiter's syndrome is? It is an autoimmune arthritis precipitated by an intestinal or sexually transmitted infection like chlamydia. It leads to a triad of clinical findings including arthritis, urethritis, and conjunctivitis. The mnemonic to remember Reiter's syndrome is that you can't pee, can't see, and can't climb a tree, referring to the urethritis, conjunctivitis, and arthritis. Next is condylomata acuminata, not to be confused with condyloma lata. Do you remember what causes condylomata acuminata? This is caused by human papillomavirus serotypes 6 and 11. This is a fancy medical term for genital warts. So now if we were to take a sample of the cells in a condyloma, do you remember what characteristic pathologic finding we would see under light microscopy? We would see coilocytic change. This is very high yield and very important to be associated with human papillomavirus infection. Genital herpes is most commonly caused by herpes simplex virus 2, but it can also be caused by herpes simplex virus 1, and it causes painful penile, vulvar, or cervical vesicles. The key word here is vesicles. Do you remember what distinguishes a primary herpes infection from a secondary herpes infection? So both are going to have the presence of vesicles, but a primary herpes infection also has the presence of systemic symptoms such as fever, headache, and kind of systemic myalgias significant of a viral syndrome. Do you remember how you would diagnose a herpes infection? You can do what is called a Sank smear or a Sank prep, where you would see multinucleated giant cells with intranuclear inclusion bodies. Gonorrhea is caused by the bacteria Neisseria gonorrhea. Do you remember what kind of bacterium it is? Remember, it is a gram-negative diplococci. This bacteria can cause urethritis, cervicitis, pelvic inflammatory disease, prostatitis, epididymitis, as well as arthritis and conjunctivitis. The key difference from chlamydia in terms of its sexually transmitted infection is that it causes a more purulent discharge. This is the key distinguishing feature. Do you remember the first-line treatment for a patient with a Neisseria gonorrhea infection? It is the third-generation cephalosporin, ceftriaxone. Hepatitis B virus is an important sexually transmitted virus. It most notably presents as jaundice. Moving on to lymphogranuloma venereum, do you remember what causes this disease? It is caused by our friend chlamydia, trachomatis, but specifically the serotypes L1 through L3. This classically presents with painless genital ulcers with painful lymphadenopathy. It can also cause rectal strictures. Syphilis is caused by Treponema pallidum. The infection, or the syphilis infection, is broken up into 3 stages. Primary syphilis is characterized by a painless chancre, or an ulcer on the penis. A secondary syphilis presents with fever, lymphadenopathy, skin rashes on the palms and soles, and importantly, it can cause a condyloma in the genital region. And the tertiary infection is associated with gummas and other manifestations, which we'll talk about in just a minute. Here's a photo of a gumma right here. Tertiary syphilis is the last stage and can present with this sort of finding, which is a locally destructive lesion of the skin, as we see in this picture. But it actually can also be a destructive lesion of the bone or involved viscera. There are many other manifestations of tertiary syphilis, including neurologic and vascular. Neurologically, syphilis can result in tabes dorsalis. Do you remember what tract of the spinal cord is most affected by tabes dorsalis? Causes problems in the dorsal column. Do you remember what sensations would be lost if the dorsal column is wiped out? We would lose the sensation of proprioception and fine discriminative touch. Lastly, trichomoniasis is caused by the protozoan Trichomonas vaginalis. Trichomoniasis presents with vaginitis and a strawberry cervix. On wet prep, we will see motile protozoa, an important finding. Do you remember the first-line treatment for a patient with trichomoniasis? We would treat him with metronidazole.